Good afternoon and hello. I am Christina Maguire, President and CEO of Mount Desert Island Hospital. Thank you for joining us today to discuss COVID-19 updates, vaccination, and of course, mitigation strategies. As COVID-19 cases across our state and our nation continue to rise, main hospitals are nearly full with only 5 available ICU beds as of today. As ICU admissions rise, health system leaders across the state are calling on all of us, all of Maine communities and all of MDI's community to help mitigate the spread of COVID-19. Mount Desert Island too has seen an increase in positive cases with 23 positive results in the month of August, which is what we tested here at MDI Hospital, which was the highest month since the beginning of the pandemic. The total positive cases tested at MDI for 2021 now is at 100, the highest since January of 2021. The total for Hancock County is at 1,205 confirmed cases, according to the Maine CDC today. Northern Light Health has begun reporting every morning from its dashboards their census across all of Northern Light hospitals, with the exception of Mayo Hospital and Dover Foxcroft. And we will share that infographic with you a bit later. As cases continue to rise, we are asking you from MDI Hospital to continue to get vaccinated if you have not, and if you will continue to wear a mask when indoors and be cautious about outdoor gatherings and indoor gatherings. We also called on this dedicated community and business partners to join once again with reinforcing these critical COVID-19 protection measures. Vaccinations, masking, distancing, and avoiding large gatherings and during crowded situations are the best defense against COVID-19. We did it last year without a vaccination, and we can do it again this year. These safe, effective strategies will work. We know they work, and they'll help to reverse the troubling trend that has happened in our region. As of the month of September, and of course we are at the 7th day of September, we have seen a slowdown in the amount of positives we tested. MDI Hospital has only tested 3 so far for the month of September. But today I'm joined by 2 colleagues and a moderator who will help us navigate questions that have been submitted to us. I introduce to you Dr. Trevor Casey, the Vice President of Innovation and Experience at MDI Hospital. Trevor has taken the lead in our vaccination administration efforts in coordination with an interdisciplinary team of physicians, pharmacists, nurses, geriatric care specialists, and infection control specialists. And to date, MDI is showing over 90 to 95% vaccination rates, which is amazing for our region, but also for the state, leading the state in vaccination efforts. Also joining me today is Dr. J R Krevans. He is the chair of our Infection Control Committee at MDI Hospital and has been a guiding force in our COVID-19 preparedness responses. He has an extensive background in public health, emergency preparedness, and the management of infectious diseases. Today, we are here to answer your COVID-19 questions, provide vaccine and testing updates, and to share information about what we've learned as vaccines are administered and treatments continue to develop. Some of your questions were submitted in advance. If you would like to ask a question, you certainly can do that by using the Q&A feature located in the bottom panel of your Zoom screen. We will answer as many questions as possible today with time permitting, and those that we do not have time to address, we certainly will always follow up via an FAQ. And now please join me in welcoming our moderator for today's town hall, Molly Moon, who will facilitate our discussion. Molly?
Thank you, Chrissy. Our first question is for J R Krevans. JR, what is the Delta variant and how is it affecting COVID-19 case rates on MDI?
You're on mute.
God, you'd think we'd have it down after.
Oh, no, not yet.
The Delta variant is a evolved version of SARS-CoV-2. SARS-CoV-2 is another name for COVID-19. It's the virus that causes it. It has some changes in the spike protein, which is the protein that the virus uses to bind to your cells. It binds to your respiratory tree and it binds to your blood vessels to cause disease. These changes in the spike protein have had two distinct effects. One of which is that it's more effective at binding to your body, so it can produce more viruses and it spreads better. It's much more contagious than the original variant. Also, because there's a change in the spike protein, which is on the outside of the virus, it makes it harder for your antibodies, whether you have these antibodies because of a previous infection or an antibody because you got a vaccine. Your antibodies don't recognize the virus quite as well as the original virus because it's changed a little bit. Because of this, the virus spreads more easily. It spreads more easily because of the nature of the virus itself, and it spreads more easily because our immunity doesn't recognize it as well. And that's driving increased cases all across the country, not just in Mount Desert Island. In fact, if you look at, for example, hospitalization rates, which are probably the best way to measure case rates from state to state, there's a lot of states in the country where hospitalization rates are 10 and 15 times higher than Maine. So it's not unique to here. It's pretty much everywhere in the country now. The additional factor that's driving these increases in case rates has been that people have chosen, initially out of a burst of optimism, when we started to get really decreasing case numbers in the spring combined with vaccination, and then out of a decision that they were not going to go back to taking care of each other, people have stopped with the common sense and effective precautions. People are refusing to wear masks. In many places, even schools, which are dense concentrations of kids who are not vaccinated, are not masked. So all of those decisions are also driving the spread of the virus along with the changes in the virus itself. One thing that is a small factor here, but not as big a factor as a lot of people make it out to be, is all of our visitors. Certainly some of the viral cases come here with visitors, but when we look at who's getting sick here, and when we talk to people about what their contacts were and how it spread, most of the viral spread here is due to one local person interacting with another local person. People getting together with their friends or going to the store, or any other close contacts. So it's not that we need to wear masks when we're in places with visitors. We need to wear masks whenever we're in public places, no matter who you're close around.
Fantastic. So our second question is for Chrissy. Chrissy, why else have cases and hospitalizations been on the rise? And how do we reverse this trend in our region?
Well, Molly, let's share an infograph that Dr. Jim Jarvis has agreed, and Northern Light has agreed to allow us to share with this town hall attendees today. And this is something that Northern Light has begun posting on their website, but also at their news conferences. And it really highlights and illuminates where there's opportunities for us to reduce the spread of COVID-19. This data is pulled as of this morning, 12:01 a.m. There are 49 hospitalized patients in the Northern Light system. And of those, there are 44 unvaccinated. Of those 49, 21 are in ICU. Of the 21, 20 are unvaccinated. And of those 49, 7 are on ventilators, and all 7 are unvaccinated. So we'll really talk about prevention measures. We know two things. What JR just said is distancing, masking, air exchanges are how we were able to mitigate and keep the spread of COVID-19 down on this island during a fairly robust summer. And we know that vaccination is key. Vaccination will lead to outcomes that are not this significant of illnesses or hospitalizations. And that is what we're really continuing to ask our community to engage in, is get vaccinated, get your children vaccinated if they are of the age of 12 and older, and help to continue to be cautious. Know who's in your bubble. We're right back to who's in your bubble, who's vaccinated, who may have been exposed to someone with COVID, because you still can get COVID even if you're vaccinated. It reduces you being on this infograph is what it can do.
Thank you, Chrissy. And I can leave this infographic up for a little while longer while we move on. Trevor, our next question is for you. We are hearing a lot about COVID-19 vaccine booster shots. When will they be available, and how will community members be able to schedule them?
Well, that's a really deep question that I'm going to step in and talk a little bit about the booster, but also the third vaccination. So currently the CDC is recommending that people that are moderately to severely immunocompromised receive an additional dose. And they're calling that a third COVID vaccine. And really that's people that have cancer, that are receiving active cancer treatment, stem cell transplants, organ transplants, some others very specialized untreated HIV infections, active treatment with high dose corticosteroids or other drugs with the purpose of diminishing or suppressing the immune system or response. That's who should get a third dose. And then we talk about the booster vaccine. So the booster vaccine is gone back and forth a little bit. The White House announced a few weeks back that we were going to get boosters as of September 20th. The government, the CDC, the FDA, and the White House all have different opinions about when that should happen and how that should happen. The FDA is currently doing an independent review of this information. We do believe that the Pfizer vaccine will be approved for boosters sometime this month, but it's probably not, there's a good chance it may not hit the date of the 20th. And Moderna, they've requested a little bit additional information. We don't have any reason to believe that these booster vaccines won't be approved, but it will probably be delayed. And so to give a date is very, very challenging at this point in time. But once we do have a date, we do have the information we need to move forward. We will be putting out a lot of information to our community. And the booster vaccine is really going to be set up for those, they haven't changed this, that since it's been 8 months since their second dose. So to begin with, that's going to be healthcare workers and those that were in long-term care facilities, really for September and October. If it comes out in September, that's really who's going to be vaccinated. And we wouldn't be doing a booster dose for anybody until they've been post second dose of their vaccination for 8 months. And so really it's going to be a slow process based on when you received your first vaccines. And that's how we're moving forward once we get more information from APIC and both the FDA and CDC as we move forward.
Yeah. And I just want to add to that question I've been getting coming in has been, what about J&J, which is a late, which we of course started with later because that was the third vaccine to be authorized. And J&J has also submitted some very promising looking data about the benefits of a second dose or a booster dose. They're actually arguing over what to call it, because the difference is whether or not it's a booster dose requires late timing, while a second dose could be given anytime. And I was actually in contact with the state about a week and a half, 2 weeks ago, and they're awaiting further data on that. So people who got J&J as their first dose for right now are not authorized to receive a repeat dose of any of the above. It's all being looked at right now.
Thank you.
I guess one other group that I used to see a lot in my previous outpatient practice, so I should mention, that may be appropriate for a third initial dose is people who are on the very high potency anti-rheumatic medications, people who are getting the injectable TNF factors, which is pretty common in our community. So those folks would be a good candidate for, and those doses are available now.
Thank you. And JR, also based on current data on the relative efficacy of Pfizer and Moderna, is there a preferred choice for those that are just now getting vaccinated? And in terms of boosters, can you mix and match vaccines?
I'll take the second first. The current recommendation, which seems unlikely to change, is that you do your best to get the same vaccine you got the first time, but it doesn't really matter much. And the current instructions, which as Trevor noted, seem to change a little bit as far as, since we've gotten no formal instructions yet. We've been getting some general guidelines about what it's going to look like. Typically say things like, you should try and give them what they got the first time, but if that's not what you're giving that day, don't let them go away empty-armed. So there's probably not a lot of difference between the two vaccines as far as mix and match for boosters, and it may in fact not be authorized to do it that way. As far as first doses, the two mRNA vaccines, the Moderna and the Pfizer, are extraordinarily similar. The initial data showed essentially identical efficacy in multiple trials between the two in terms of both prevention of disease and prevention of severe disease. And both in the 90+% for any disease and close to 100% for severe disease. Moderna uses a slightly higher dose of mRNA, which tends to lead to a slightly higher rate of sore arms and I don't feel well after the second dose, which people sort of did notice. Places like us that got Moderna, had more people who just didn't feel up to much after the second dose. What we're seeing 7-8 months out is that there's a slightly higher antibody levels that you can measure. And in a couple of small, I'm going to call them data sets rather than studies because they haven't been published yet. Florida and Minnesota have done some preliminary comparisons, and they think that against the Delta virus, Moderna is holding up better by a little bit than the Pfizer. While other data sets have not shown that. So there may be a slightly better efficacy for minor disease with Moderna and slightly more sore arms. But it's a very small difference if there's any. And we will see, that's one of the things that they're looking at in the current comparisons that's going on right now at the FDA and CDC.
Thank you, JR. Our next question is for you, Trevor. Trevor, do you have any sense of when children aged 12 and under might be eligible for the COVID-19 vaccine? While we wait for approval for younger children, how would you recommend that parents and families prepare themselves for the start of the school year?
So I would love to say that we'll have vaccine available out to our children by Thanksgiving. And there's a possibility of that. We do expect, and there's rumor that Pfizer is ready to put in their application towards the end of this month, in the first part of October. How long that application is going to take to get a UA status for that age group really is up to be seen, but we'll see where that goes. So hopefully by the end of this year, we will see a vaccine for that age group. And I believe it's 5 to 11 is what they're looking at, but some I've seen 4 to 11, depending on which vaccine you're talking about. But I do think that we'll see one by the end of the year. As we're preparing for school and those pieces, I think masking and just teaching our kids good hand hygiene, how to sneeze into your sleeve. Sorry, I was talking while I did that, but sneeze into your sleeve, sneeze into your elbow. Good hand hygiene. If you're inside and following the rules and doing what they're supposed to be doing. I have a 6-year-old that loves to wear his mask. We call it his ninja mask. He puts it on, he leaves it on. Sometimes I have to tell him to take it off. So just trying to make it fun for him and do the best, but really trying to teach those good hand hygiene, washing their hands, and recognizing who's in their bubble and just using that general common sense to do their best while they're in those situations. because I don't think there's anybody out here that doesn't want their kids in school. I know I want all mine to be in school. And so it's very important just to make sure that they're doing everything they can to protect themselves and to protect their neighbor.
Thanks, Trevor. I actually do have another question that came into the Q&A for you. So the question is, what is the best way for me to discuss the vaccine? For example, if I am supportive of the vaccine, but the person I'm talking with is not. Can you give a short example of maybe how to talk about being supportive of the vaccine?
You know, I think that demographic that Northern Lights puts up is very, very powerful. For me, I don't try to convince anybody that the vaccine is right for them. I just try to give the science behind it. There's a lot of bad information out there. My job isn't to prove that their information isn't accurate or isn't right. And there's a lot of strong feelings and opinions, but I really try to go back to the CDC information. And there's a lot of really good information out there that we can lean on and gain strength from as we talk about the vaccine. We've been working with the employees of the hospital. Dr. Krevans has been talking to many of them we do have the hospital mandate, and just trying to help people understand what the risks are, both of the vaccination and what the risks are from getting COVID. And we just try to balance those risks and benefits in healthcare. It's not up to us to tell them what they need to do, but it is our job, and that's what we get paid to do, is to give people the scientific data that supports the vaccination and talk about how important it really is, not only for us as individuals, but for our communities as a whole.
Thank you so much for responding to that, Trevor. Chrissy, as we approach fall and winter where more people will be indoors, what safety precautions should we be thinking about for public health?
Well, first, Molly, JR, Trevor, and I are planning on being outdoor skiing. Other than that, we're good with the winter. But let's talk a little bit about what we did last year, right? Some of the statistics that were disheartening for us as we came off of our summer months and we were headed into October and November, we started to see spikes of increases because people were indoors, people were gathering, the holidays were coming. So we anticipate that we might start to see some spikes. Now, Trevor hit on everything I would have answered on this, right? Who's in your bubble? Are they vaccinated? Have they been around anyone who possibly could have come in contact with COVID, because an asymptomatic person can be a carrier? And really look at what JR has now taught me is air. Look at the air exchange. So how much air can be exchanged even indoors, right? You might have to keep windows open. You might have to burn more pellets. You might have to do things that you typically wouldn't do given or post-pandemic. But things to be cautious of are who's coming over? Who are you going to be around? I would say be very cautious of those who are super seniors and young kids now. Those are the ones who are super seniors, are now getting ready to come up to that booster whenever, as Trevor and JR has said, the government's agreed to align again. And those individuals will need to be receive their booster shots. And we want to make sure that they have received their booster shots before you start to gather again. I think the most important thing is just to remember that this is still an infectious disease. It still is a sticky little wicket right now, and we need to be very cautious about how can you do things outdoors and how can you make sure you keep windows open. Masking is okay. Masking is really important to do, and to teach. To Trevor's point, he taught his kid that how much fun a mask could be, but trying to make sure that you continue to do exactly what we did last year. Exactly who, what, and where, and make sure that you practice those prevention strategies. The other thing that I think is important is we do have an opportunity, as Trevor said, to share information. And as the public health for this community and for this island, we share information and we make ourselves available to the community to help answer those questions, because they can be scary. And we want to make sure that we share with them all of the available information. We always believe in informed consent and shared decision making. And it's really helpful when people are seeking information that they come to experts such as Trevor and JR and have access to them to help answer those questions about the vaccine. And I know what I hear most often than not, and we have to be cautious here, and JR will do a deeper dive in this, is, well, I'm vaccinated, I don't have to do any of that. We really need to be cautious about that because vaccination is a mitigation tool, just like masking and air exchanges and good hand hygiene and sneezing into your sleeve. Those are all great mitigation tools, but they do not prevent 100% transmission.
Thank you so much, Chrissy. Our next question is for JR, and JR, it's a two-parter. So let's start with the first half. What do we know today about the safety and efficacy of COVID-19 vaccines?
Quite a bit. And actually, we just got about a week and a half, 2 weeks ago, 2 weeks, to some huge, extraordinarily complete new data I can discuss in a minute. But first, I want to mention, just because of a question that was asked earlier that was worded a little bit off, but it's important. You asked about vaccines, of when vaccines will be available for 12 and under. The actual issue is under 12. If you have a 12-year-old out there right now who is not yet vaccinated, they can get vaccinated with Pfizer. And one group that I'm particularly concerned about are kids who are 11 right now, or were 11 when the big push happened over the summer and are now turning 12. If your child is turning 12 this fall, get them vaccinated as soon as they turn 12. We'll be able to do it then, and they will be protected. And I've got some data about hospitalizations we'll talk about. So spectacular new safety data. So the early safety data we had, the first was based upon about 100,000 people who were very closely followed in the vaccine trials, where literally every one of those people was examined on a regular basis. We knew every little thing that happened. And so anything that happened with any frequency, 1 in 10,000, we found out about during the vaccine trials before the first approvals in last year at Christmas. Best Christmas present ever. But then you start to think about some of the rare side effects, things that happen 1 in 100,000, 1 in a million. And we've been looking for those things as we have given the vaccine to hundreds of millions of people. And they're what are called surveillance systems, which means that either when someone notices something, they turn in a report, that's VAERS, or there's a system that about 9 million people in this country who got a COVID vaccine entered a program where they got an app onto their smartphone where they recorded anything that happened to them, which made it very easy. And we're getting the data off that now. And that has enormous amounts of data, and it has shown basically no surprises. And that's very good because a lot of those people were people who were not included in the early trials. In particular, we now have safety data in pregnant women, in nursing women, in women who want to become pregnant. And all of those groups have been shown to be safe to be vaccinated. In fact, in particular for pregnant women, pregnancy is now one of the strong indications for vaccination because women who get COVID while they're pregnant often have terrible outcomes for themselves and their babies, like lose their babies or the baby lives and the mother doesn't. So it's very important that pregnant women get vaccinated. And we got that. We now have that information with millions of people. But the most useful in terms of really hard data was 2 weeks ago, there was an extensive trial published in New England Journal of Medicine. Israel has a complete national health system where they have electronic medical record on every single person. And because they had an electronic medical record on every single person, they could compare outcomes in people who got the vaccines and not, looking at what actually happened. not just what's got reported, what people noticed. And they had no surprises whatsoever. The only thing that was more common in vaccinated was a minor degree of myocarditis, meaning irritation of the heart muscle, which was more common after vaccination, about 3 in 100,000, I believe. Yes, about 2.7 in 100,000 vaccinations. Interestingly, however, in people who were not vaccinated and got COVID, it was about 20 in 100,000. So you actually, over time, were more likely to develop this particular problem if you weren't vaccinated than if you were, because you got COVID. So that there are very few medications where we have a trial with 5 million people in it with complete data. But we do have that for the COVID vaccines. Very reassuring.
Are you ready for your next part?
I don't know.
Okay. The second half of the question is, why are masks still recommended in public if you're vaccinated?
Okay. So I'm going to change the word in public. Why are masks still strongly recommended, and in many cases, for a lot of us, required, in enclosed places where you're sharing air with people, if you're vaccinated? So if I'm standing 10 feet from people in open air, I don't need to be wearing a mask. I mean, I'm in public, but I'm not particularly sharing air. We have lots of ventilation. We're outside. If I'm in an office that other people, where I'm sitting all day and other people are going to be sitting near me and breathing the air I breathe out, I need to be wearing a mask. The reason is very simple. Well, two things go into it. One of which is that the vaccine is excellent, but it's not perfect. Depending upon the series and even remember, the Delta variant is not monolithic. There's not a Delta variant. There's a group of viruses that we, if they meet certain characteristics, call them Delta variants. If you think of SARS-CoV-2 as dogs, and you think of Labrador retrievers, some Labrador retrievers weigh 45 pounds and some Labrador retrievers weigh 90 pounds. They're not all identical. So for various reasons, we'll say that the vaccine efficacy is somewhere around 70%, meaning it's much less likely that you will get COVID and transmit COVID if you get the vaccine than if you don't. Basically, it's about 3 times more likely that you're going to be spreading it if you're unvaccinated. But that doesn't mean that I have zero risk of spreading it if I'm vaccinated. So the reason I need to wear a mask is so that I don't spread it to other people. And this reaches back a little bit to what Trevor said about protecting your kids and protecting the elderly. A mask that you wear is pretty good at protecting you. It's not perfect. If you wear it really well, it's better. The mask that a person wears is extraordinarily good at preventing them from spraying virus into the air every time they breathe. And this is the reason why everybody should be wearing a mask when they're in a closed place. I don't shop in stores where most people are not wearing masks. I don't shop in stores where the people who work there are not wearing masks while they work. Why should I breathe what they've been breathing out all day? Because even if they're vaccinated, there is a chance that they are still going to spread it. And the greater the consequences of that, the more important it is to vaccinate and be masked. So for example, healthcare workers have to be vaccinated and have to wear masks at work. We work with too many people who are immunosuppressed and too many people who don't have any choice about being there. The CDC has recommended that all schools, everyone is masked in the school building nationwide, unless there is very low transmission in your area, which is basically nowhere in the country right now. There are a lot of school districts which have chosen to allow spread of COVID in their schools. I actually don't understand why they choose that. Our school district here, and I know Ellsworth also, has chosen to require people to wear masks so that they don't spread COVID in the schools. It's an important place not to spread COVID because, to start with, anyone 11 and under is not vaccinated. And people have to be there. They have no choice about coming there. I can choose not to go to a movie theater, but if I'm an 8-year-old, I can't choose not to go to school. And anyone who is responsible for the care of an older person. So if you visit your mother every weekend, you need to not be around people who are choosing not to mask, as well as, of course, you should be vaccinated. Those are all choices you can make.
So JR, to dovetail from the second half of that question, several attendees have submitted into the Q&A, do cloth masks work, or do I need to wear surgical or N95 masks or even layer masks? What would you respond to that?
Okay, very good questions. And we actually have more data about this than we did a few months ago. To protect yourself, a really well-fitted level 3 surgical mask, which is what the hospital mostly gives out now, or an N95 if you know how to fit it and wear it, N95 being the best, will give you the best protection. The fit really does matter, whether it's a surgical mask or an N95. If it goes around, it goes around. Cloth masks, until recently, we knew that surgical masks were better for protecting you than cloth masks were. But there was a question of whether or not cloth masks were as effective at preventing you from infecting others. And now there's some fairly good data out of Bangladesh, big study, where they had a bunch of villages that were interested in preventing COVID spread in their villages, and they actually randomized them to different kinds of masks because that was how they could get it done, get people to supply it. And the villages that used masks more had much less COVID rates, and the villages that used surgical masks did better than cloth masks. There's some better data for that now. So yes, the level 3 surgical masks are better, but a well-fitted cloth mask is pretty good at keeping you from infecting others. Not perfect, but doesn't do that much to protect you. The layering thing is pretty straightforward, and that is that a lot of the cloth masks are much easier to fit nicely. So a very lightweight cloth mask over your surgical mask to hold the surgical mask nicely in place is a very good combination. So it's just a matter, you can sort of tell if it fits well, and it's a paper electrostatic mask, a surgical mask, it's going to do a good job, but that fit matters. And face shields don't do anything in the absence of a mask. The only benefit of the face shields is if you're in a high spray environment, like working in an ER when liquids that you don't want on you are spraying around, you want that over your mask. Doesn't do anything in a grocery store.
Thanks, JR. So Chrissy, our next question is for you. Chrissy, how is the hospital addressing mental health and pandemic fatigue?
Wow, a great question, Molly. It's really hard. It's one of the hardest things we've had to deal with the ongoing pandemic, the responses that we have to make, but we're trying to offer our teams the opportunity for really taking care of themselves, self-care, mindfulness, really important to have some mindfulness in what we're doing. We're also making sure that as much as we can, there is a workforce scarcity. Everyone's experiencing it, not just healthcare, but we also know that we're hitting the crux of shortages in our labor. So how do we balance that? The need to take care of our patients and offer services to our community and keep our team resilient and healthy. So we continue to do what we always have done, is provide all of the support services we possibly can, encourage time off, encourage self-care. And I think pandemic fatigue will go on, and that we'll do everything we can just to support our teams and this community to get past that. This August really was difficult for us to see. We had 3 positive cases in July, and to have that uptick. Now we seem to be going back down in the right direction, so that's helpful as well. Our team stays at the ready. So you have to remember they're at the ready for all of the situations that might happen. And that really is physically and emotionally challenging. So we have to, when we start to see the positivity rate go back down, it's really healthy and helpful for everyone.
Thank
And
you.
Molly, one of the things I wanted to say on a previous question, because I think JR, Trevor and I have all said it, but if you are not vaccinated or you have someone coming into your home who is not vaccinated, we highly recommend masking.
Yes, absolutely. Thank you so much for that, Chrissy. And Trevor, our next question is for you. So back to the boosters that you were speaking to earlier, do you think that booster shots should be sooner than 8 months from the last vaccination? And what about those over 70 years of age?
No, the studies that we've seen really show that the boosters need to be about 8 months, that the vaccine is starting to wane to about 80% is what I generally see. Maybe JR, if you've seen other things, but we've seen it wane to about 80% effectiveness. And they really want to boost us when we're about that point and really push that back up before it gets too low. And so that's really why that 8-month point is important. If somebody has some immunocompromising issues, that would be something I would consider. But definitely I would really wait till the 8 month, and I don't think it's gonna be approved before the 8-month point either. So that's really gonna be a guidance that we're gonna be working off of as we move forward, and as we learn more about what standards and procedures we're working through that were given from the federal government and from the state government as well. And what was the second part of that question?
The second part of that question was, what about those over 70 years of age?
And so that group of people really will be one of the first groups that gets vaccinated after healthcare workers. That's who we focused on, was our super seniors. And so those that live in long-term care settings really should be getting the vaccine relatively quick, because they were some of the first vaccinated as well. Now, if they waited to be vaccinated until later, they really would need to wait that 8-month time period. But they still have a much higher level of immunity at this point in time.
Thank you very much, Trevor. So Chrissy, I'm going to tee this next question back up to you. Is MDI Hospital still distributing masks to local businesses and organizations? There's a second part, but let's start with that.
Okay, yes. The answer is yes. We have early on in the year, we ordered per Dr. Krevans specifications to have all of the proper masks available. Our amazing materials management and purchasing team had over 50,000 masks ordered and ready for the season to begin. And so we do have those available and continue to have those available.
And the second half of that question is, how do businesses and organizations go about accessing these?
A couple of ways. The first is our partners at the Bar Harbor Chamber of Commerce and the Mount Desert Chamber of Commerce, both Alf and Mickey, have availability to reach out, get masks, or distribute them. So you can reach out to, if you're a chamber member, but you also can call our hospital's COVID-19 hotline, which I know we're going to put in the chat, and ask for Mary or Laura. And they actually will deliver them to your business or organization, along with posters and educational materials that you might need to help anyone who's questioning why they should be wearing a mask.
Thank you, Chrissy. JR, our next question is for you. It's been difficult to obtain asymptomatic PCR testing for travel and surveillance in Maine lately. Are over-the-counter antigen tests a viable alternative?
So I'll answer a couple different things. One of which is testing for travel is less needed than it used to be, partly because Maine is no longer requiring it for returning. If you're not a healthcare worker, you don't need to test when you return. And if you are a healthcare worker, it doesn't matter if you test, you still basically, if you're not vaccinated, can't work for 2 weeks. And which is rapidly going to not matter, as pretty much all healthcare workers will be vaccinated over the next few months, well, next month and a half. So it matters some right now, but the Binax Now, and I'm going to use the brand name because it's the only one whose data has been robust and consistent. And that's the most commonly available rapid test. Is a very good test. They've reformulated it. They've done a pretty good job with their quality control, and there have been more studies on it. A lot of organizations use it. We actually use it to help protect our Birch Bay retirement community. The school district has used it. The Binax Now test is a simpler swab than the very deep swab that is often used for PCR. It doesn't have to go as deep, which is nice. It is quite what we call specific, which means if it says, I found COVID, it means it almost certainly found COVID. It doesn't bark, it doesn't have false alarms. It is less sensitive than PCR. It will miss some PCR positive cases. But this has been looked at very carefully in the last couple months. And what we've found is it misses 2 groups of PCR positives, one of which really doesn't matter much. If someone had a minor case of COVID or even a serious case and they're very far along in their course, they will continue to have RNA, genetic material, in their nose for a period of time, but they will not be particularly contagious. And we know that they're not particularly contagious by a couple different ways, one of which is some very nice epidemiologic studies where Korea did an excellent one where they showed that these people who were late in their course did not infect their family members. The other way we can do this is with viral culture, which is a very difficult test. We don't normally do viral cultures, especially for super dangerous viruses. You can imagine you really don't want to be growing COVID-19 in your lab. And so, but they've done comparison testing and they've shown that the Binax Now test, if it says you're negative, the chance that you will have a positive viral culture, meaning you're able to spread it, is pretty low. The group it occasionally misses, and this will matters a lot for travel, is sometimes it misses a very early case. So in other words, like a day or two after you got infected, but before you feel sick, you may have a very low amount in your nose. And the Binax Now test could miss that. And as opposed to the other thing where if it misses a late case, if you're negative, you're going to stay negative. In this case, you may become very contagious in a day or two. The reason that matters for travel is Hawaii. And that's where a lot of people want to travel that requires a test. Hawaii does not accept the antigen tests, including the Binax Now. So you have Hawaii actually lists even what labs they will trust for your PCR. So if you're thinking of traveling to Hawaii, you need to go on their website and go to one of their, what they call, quote, trusted partners, or you're not going to get beyond the airport.
Thank you, JR. I actually just popped in a few things to our chat for those of us who are on. We have our coronavirus call center line and also our specific health center contact information right in the chat. JR, I have another question for you from the Q&A. So are there options to get antibody testing here on MDI? Or if you could suggest where to begin looking for that testing, that would be helpful for people in the chat.
So antibody testing would need to be ordered. We need to know why you needed it. You need to have mean, our lab can send out a variety of antibody tests. The issue is no one is certain what to do with them. And this is a question that has come in quite a bit. One of the main reasons people were doing antibody tests, which has now gone out, was initially the question came, people who were immunosuppressed, if they got a couple doses of vaccine, they wanted to know if the vaccine worked, if they should get an antibody test. That does not seem to correlate well. So basically what we're saying is if you're significantly immunosuppressed, you should get a third dose in your initial series, no matter what your antibody test shows. And for people who are wondering if they had coronavirus last year, an antibody test may or may not tell you that. Some of the antibody tests are accurate, some are not. But the antibody tests don't correlate well with protection. And the recommendation is that even if you have had coronavirus, you still should get vaccinated. There is some research that is suggesting that perhaps these folks only need one dose and not two, but that is a research level question. And if you're interested in a one dose series because you think you've had it, you should be going to a research center, which we are not, to try and be part of our study. So I don't know of a lot of reasons to get them. They are able to be ordered if there's some specific reason between you and your medical practitioner. They can help you pick out a test, but it's been a while since I've had any reason to order one that in the questions that I've asked.
Wonderful. Actually, Trevor, my next question is for you. We have another one in the Q&A. So we would like to know, what is the current vaccination rate on MDI?
The current vaccination rate is high. And the state website says 99%. We do believe that that's a little bit of an overestimate, but we really believe that's between 90 and 95% vaccination rate on Mount Desert Island. And we're very proud of that. And we know there's still those that aren't vaccinated in our area, and we highly encourage them to come see us. But we really know that we live in a highly vaccinated area, and that's a lot to be proud of. And we want to continue to make sure that we get everybody that is out there and able to the vaccine.
Thank you. Thank you both, Trevor and J R, for responding to those two Q&A questions. Chrissy, our next question is for you. Chrissy, when does the state's COVID-19 vaccine mandate for healthcare workers go into effect? And are there any exemptions to this mandate?
So I'll start with saying, Molly, it's actually, COVID has been added to the state's current law for immunizations for healthcare workers. And just as the flu vaccine, influenza vaccine was updated to that immunization requirement for healthcare workers, COVID was most recently added to that. There is some confusion around some of the dates. So this is what we know. The law has not changed. On October 1st, 2021, the law requires that all healthcare workers are immunized for COVID-19, fully vaccinated, in order to continue to work at a healthcare facility, which includes hospitals, dental offices, residential care facilities, nursing home, etc. What the state did last week was extend enforcement of that law. So what they've agreed to do, because when they added COVID to the immunization requirements, it was still under EUA, meaning all three vaccines were under emergency use authorization. Pfizer came off of emergency use authorization and is fully vetted through the FDA's processes. So the state felt that if somebody was concerned about having a vaccination protocol for a vaccine that wasn't off emergency use, that they would extend the enforcement period. So effective October 29th, or the 30th, if you will, hospitals and healthcare providers must have all of their employees vaccinated 100%. Or there is one exception, and that is a medical waiver, which states between a provider and a patient or employee that there is a contradiction for a medical contradiction for them to be able to receive the COVID-19 vaccine. Fully vaccinated, remember, is 2 weeks past your second dose of Moderna or Pfizer, and 2 weeks past your 1 dose of Janssen or Johnson or J&J.
Thanks, Chrissy. I have a question for you from the Q&A as well. Is there any long-term COVID care in the area, or are there any plans for creating one that you know of?
Wow, excellent question. We continue, this is a respiratory disease. We have many respiratory diseases that we treat. Our continued care for COVID-19 will mimic what we do with other respiratory infectious diseases. Currently, we have respiratory rooms in our primary care practices in Southwest Harbor, Trenton, and at Cooper Gilmore in order to treat and take care of individuals who may have COVID or are diagnosed with COVID. And we have in our inpatient floors, we have the expertise of our hospitalist program as well as our nurses to care for them. Long term, our long hauler, we'll let JR answer that. But for access to care, we certainly would continue to provide services.
Yeah, I was about to say, because you were talking about our long-term plans to be able to do this safely for the community, which we have done a bunch. We do not have a long hauler clinic that I am aware of. And it may be that one of our medical staff is going to take a special interest in this. We have not, because our number of COVID cases in our community has been low. We have not had that as a big question that has arisen, because if you don't get COVID in the first place, you won't get, but that is something that may be there. I also don't know, there may be someone up at Eastern Maine who's got a clinic related, that is starting to look at this question. I am not aware of that. And that's something that we can put out an inquiry to the medical staff to see if anyone in any of the clinics is aware of that.
Yeah, and I will follow up with both Dr. Mills from Maine Health and Dr. Jarvis from Northern Light to see if they are planning on any type of specialty clinics with regard to long haul COVID diagnoses.
Thank you both for adding to that one. Trevor, our next question is for you. Who should people contact if they have questions about COVID-19 vaccines?
They can always call our COVID hotline. If they really want to have a question about the COVID vaccine, the best way is to email covidvaccine@mdihospital.org. That's monitored by myself, Dr. Krevans, clinic nurses. The pharmacy team also monitors that. And that's probably the best way to get the quickest direct answer and be able to have a follow-up conversation or email with a response to answer your question or concerns regarding the vaccine.
I will go ahead and pop that into the chat. And also for everyone on this webinar, I did also put in to request a distribution of medical grade masks, or for more information, please contact Mary Parham. That's our community health educator. Her number is 801-5034, and she can also be reached at her email at mary.parham@mdihospital.org. That was our last question for today's virtual town hall. Chrissy, I will turn it back over to you to close.
All right. Well, thank you all for your thoughtful questions and for joining us this afternoon. I'd like to thank both Trevor and JR for taking time to share their insights and expertise with us today. We want you all to know how grateful we are for what you've done to keep this community safe and this island safe. Our COVID-19 pandemic response continues. We are deeply committed to providing you with evidence-based care and as much information, education, and support as possible. Vaccinations, masking, and distancing continue to be our best tools to combat this pandemic. Vaccines are currently available by appointment at 3 of our health centers: Cooper Gilmore Health Center in Bar Harbor, the Trenton Health Center located on the Bar Harbor Road in Trenton, and our Community Health Center in Southwest Harbor. Again, thank you for your ongoing commitment to our health and the vibrancy of this wonderful community. And we appreciate you participating in today's discussion. There are questions we did not have a chance to get to. We will go through the Q&A section and respond to those through an FAQ on our website. Again, thank you for your time and have a great afternoon.